There was a big study in 2020 in the Journal of Sexual Medicine, and they looked at like 15,000 adults in the US, and they followed them for like 7 years or so. And they found that people, women, men and women, who had sex at least once a week had a 50% lower all-cause mortality rate compared to people
50%?
50.
Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality.
So welcome back to Hot for Your Health, and welcome back, Dr. Amy Killen, who is, I'm going to introduce you now. You need no introduction. And to my crowd, we spoke last year, but you are by training an emergency room doctor, made the switch after a long practice to precision medicine, longevity. You now practice in your own clinic, but you may have always been this way, but I'm adding to my crowd's knowledge of you, entrepreneur and executive, because you have co-founded and launched Humanaut and are leading that specialized precision clinic now. And you are writing just fascinating things that I wanted to talk about. So welcome back.
Well, thanks for having me. I've always loved talking to you in person or, this way as well.
We were just talking off camera that you and I are going to be at several things this fall together. So I'm really excited about some of the United States things, but we're going to Saudi Arabia to the Zeno conference coming up. So
yes,
it's
that's
a
going to be so
worldwide conversation.
It's going to be crazy. I haven't ever been to Saudi Arabia, so I'm excited to go there with some other like cool, strong women. You, Cynthia Thurlow is going to go. It's going to be really fun.
It will be. Well, in my world, in my professional world of orthopedic surgery, there's about 94% men. I find, and it's relevant. So the orthopedic medicine as we know it is very male centric. It's from the point of view of male doctors, from the point of view, even though 51% or so of all of our patients are women, it's the point of view people bring to it. It's their lived experience that flavors. And, I have to tell you that in the last 3-4 years, as I've entered the clinical longevity space, which is where I met you. You're one of the founding doctors in Longevity Docs, which is a group of about 450 at this point. I find, and tell me if I'm wrong, I'm happy to be wrong, but I find that the popular perspective as it comes to longevity is also the same point of view through male eyes. What are your thoughts on that?
Yeah, I think so. I mean, certainly there are a lot of things that are good for all of us. They're good for men and women at the same degree. But I mean, as you know, women just haven't been studied. It was always kind of assumed that we could just take male research, we could pink it and shrink it, as they say, and we can. Have you not heard that? Pink it and shrink it.
I never
essentially, we can just we can call it female. And we know now that we are not just smaller versions of men. And as you know, it wasn't until the early 1990s that women were even mandated to be included in research. And then I think it's been a hard road since then still.
And yet when you write about, you make that very clear when you write about it, that the approach to women's biology, not studied, but even taking what we know has to be considered a different physiology, right? And as we think about that, I'd like you to reflect for my audience. They hear me say it all the time, but you wrote in your Substack, which is brilliant. Everybody should go subscribe to it. You wrote early on about longevity is $1 billion industry, and yet there's a tiny miss. There's a cheap miss. There's an inexpensive miss that is just like, oh my God, how did we not think of that? So let's talk about in the $1 billion being spent on gadgets. I mean, my office is full of gadgets I'm sent. What are we missing?
Yeah, the $1 billion drug that costs $30 is estrogen.
What?
I mean, when I say
we make it, I
if,
mean,
if estradiol, if it came out today, I firmly believe if it just was introduced into the ecosystem today by like a pharmaceutical company and they went through the studies and they had estradiol as a pharmaceutical product, they would be a multi-billion dollar company. They would sell estradiol like they're selling GLP-1s, like they're selling, all these other drugs as a longevity drug that has multiple uses, and
mhm,
they would make tons of money. But
yeah.
because that's not what happened, it has kind of gotten pushed to the side and nobody talks about it, even in the longevity space.
Which is very interesting because the first time you introduced me to the longevity doctors, it was on a panel of four women who think about this a lot, and that we said a lot about that in that space, right?
Yeah.
But it was the only panel that day.
And honestly, then that was a different, I mean, that was an exceptional panel. It was for very forward-thinking women who've been, in this like this part of medicine for a while. But I go to all these longevity events, and a lot of it's first of all, it's probably 70% men, male company owners, male venture capitalists, male tech guys, male, it's a bunch of guys, which is, that's just great.
Fine, we love them.
And but there are no discussions, very few discussions of any differences between men and women. And there are very few, if any, discussions of things like ovarian aging, which we know is so important for female longevity, of, hormone replacement, which we know is so like, if they have it, it's like they have like a back room, like a dark back room, panel in the afternoon at 3 o'clock when everyone's tired. And it's like the women's longevity panel,
Yeah.
the very back room where no one's going to attend.
So if we were creating the vocal piece, which we are, I mean, there's upcoming women's longevity conferences that we're both involved in, that I'm thinking of. You've already mentioned estrogen, but how does our point of view need to be different? And at what age do we need to be introducing this longevity pathway for women?
That's a great question. I think, women are, when we think about the differences between men and women, men exist on kind of a 24-hour cycle, right? Like it's every day, 24 hours, new day, new hormones, et cetera. So women also have a 24-hour cycle, but then we also have a 30-ish day cycle. So it's kind of like, the moon is going around the earth, but
Uh-huh.
then the earth is also going around the sun. And so you have these, it's a much more complex system. And so first of all, I think we just have, even younger women, we should be thinking about, women who are in their 20s and 30s, and how is their cycle affecting their health? I feel like, yes, we know that we're cycling. We know it's a big pain every month to have buy tampons, but like no one talks about like, what does that mean for your health? And how is that an indicator of other things that are going on in your body? So I think even starting in younger women is important.
And I think, although tolerating our cycles every month, maybe I'm the wrong person to, maybe everybody knows but me. I paid very little attention other than to, when's this going to happen? I need to predict it.
Yeah.
Not the biology of what's happening as our egg is maturing, what happens when it ovulates, what happens, and the real biologic changes. So I'm just trying to get women who are exiting that phase to understand their bodies. But so if you wanted young women, I call it the critical decade, 35 to 45, to know, okay, this is what you've been cycling and this is what's going to happen. What are the three things that they need to memorize right now so that we can address midlife going forward from a
I mean, I think
longevity perspective?
a few things are at age 35, I would hope that you would start to find a physician or medical provider that can be kind of your co-pilot for the
Mhm.
next, number of years. Because even if you don't have problems or symptoms, you need someone who can kind of walk you through what's going to happen, be there when it does happen, be able to kind of guide you. So find that person, and that's very difficult, but find that person.
Good.
I think, understanding, doing your own research, understanding what's coming, and it's different for everyone, which is why it's hard. You may have 10 years of perimenopause, you may have 1 year, you may have 30 symptoms, you may have none. And so it's very different for everyone, but do your own research and then really work work on the things that are just foundational that we all know are good for us. You talk all the time about strength training, and that I think is such an important one in that age, like that age group, like build those muscles. But all the other things too, healthy living, sleeping, stress reduction, social relationships, et cetera. Just work on those foundations as well.
I love that perspective. And that's often what I tell people while you still have your estrogen, work on those foundations, know where you're going to go, know what it even means to not have it anymore.
Yeah.
Yeah. So important. At what age, you've written about this too, at what age in your clinics do you counsel women, or maybe it's individual, it's too individual to even talk about, to pivot into hormone optimization, as you like to call it in your work? I don't know. Birth control is 10 times the dose of bioidentical hormones, right? And
yeah.
So when is that grayness as you're counseling people? And remember, people, this is not your medical advice. This is
right.
This is Dr. Amy and I exploring ideas together. But yeah.
Well, I mean, I think that when we talk about, so I talk about hormone optimization therapy because I think it's a little bit broader than just menopause therapy. To me, there's a lot, it's a big zone here. Usually it's kind of in that perimenopausal window. And again, could be anywhere from 1 to 10 years before menopause onset. Menopause onset can start as early as 45 and still be considered normal. So you march back, maybe that's 35, maybe it's 40. I start thinking about potentially adding hormones like progesterone, depending on symptoms and what's happening with the person. And it can be tricky because women in that age group oftentimes still need birth control. Like they're like, well, I don't actually, I do need something to control, prevent my body from sperm attacks. So, but we also know that birth control is not the best answer long term for hormone replacement. Like birth control has a function, it's to prevent births. It is not the best tool for like lifelong hormone health, though. So it's tricky.
Yeah, and that is where precision medicine, the approach that every woman gets her own decision making, is so critical. Yeah. So while we're on this 35 to 45-ish going into menopause, and we've talked about hormones, we've talked about decision making, is there, because you're also an expert in this, is there a supplement stack that can fill the gaps? What are the main micronutrients or main longevity things that you're concerned about?
I think certainly you want to get as much of your micronutrients from food as you can. Like I'm certainly a big advocate and healthy diet, and that's the best way to get vitamins and minerals is from food. Get some sunlight on your skin, even though you got to protect your face for age. But just cover up your face. Get a little sunlight if you can for your vitamin D, but then look at, what are your particular holes and some common things that we see, vitamin D is often low, even if you're getting some sun. Vitamin D3 and K2 together, that's a great combination for bone health and for cardiovascular health. Magnesium is something else that's oftentimes low in a lot of people, and especially in women. It can really help kind of relax you, can help kind of with sleep and things like that. And it also is just important generally for bone health as well as other forms of health. Another one that I like a lot, which is in my supplement stack, my hot box stack, is either berberine or dihydroberberine. And that is a really good one.
What? Is that for heart health? Is that what
that is for it? It's mostly for blood sugar. It's comparable to metformin in its ability to improve blood sugar, but it's a natural source. It also is good for lipids and kind of just metabolic health in general. And again, not everyone needs it necessarily, but we know that blood sugar, and even like a sort of high normal blood sugar that's not even pre-diabetic yet, the higher the blood sugar, the more you're going to sort of faster you're going to age. So keeping that down can be helpful as well.
Interesting. So that's not a huge stack because so many people come in consuming as so much gel capsule plastic every day for their 20 supplements. So, but that does not seem overwhelming. If people are listening and they're like, oh, I can do that.
I mean, there are other things. I mean, certainly in my product, in Hot Box, we have 19 ingredients in 5 pills. So we kind of put them together into a small number of pills because I don't want to take 30 pills a day. Right. I think most people are not taking handfuls of pills. Some people are, but that's not my thing.
Right. And it's hard to be consistent when you do that.
Yeah, exactly. It's, I mean, who wants to eat all of their calories in pills? I don't know if pills have calories, but if they feel like they do.
A lot to remember. It is. And so I love the pattern I'm hearing from you, because you are an allopathic doctor. You are trained, board certified. You've done the road that we've all done. And that's something I appreciate about the longevity doc group of us. I have met very few people in the group that haven't gone through the gauntlet like we have. And it gives us a perspective. And what I hear you saying, and correct me if I'm wrong, is that you're optimizing health first. You are not immediately going to all the gadgets that we're going to talk about in a minute, but let's optimize your health. Let's fill the gaps. And
Yeah.
that's because you come from the viewpoint of a medical doctor. Is that true?
Yeah. I think
Yeah.
that's true. I think, the work on like the foundations are foundational for a reason. Like you don't build a house on a, rickety foundation. So certainly I love gadgets, I love supplements, I love extra tools and different things that for us to do. But I think if you don't start with the basics, you're just setting yourself up for failure.
Yeah. Well, and the kind of optimization that you're talking about and that we were trained in is, just to make a distinction, we can talk about this philosophically too, is evidence-based, meaning this is the quote the randomized control trials, quote the meta-analysis, which you just did. Listen, Amy, I read more about you this time than I have in the past. You went back, this is an example. You went back and in your Substack, you're like, I hung up on my family and I reevaluated the evidence-based literature on collagen, right?
Yeah.
Yes. So that is a very evidence-based, allopathic, traditional medicine. We are going to know the literature and we're going to prescribe from it. And I don't want to give my listeners the end of the story, because I want them to go read, but you reevaluated all the literature and changed your mind.
Yeah.
But what often happens is when people come to me for my longevity practice called Precision Longevity, is people come wanting the gadgets and the evidence influenced ideas that they have heard on the internet or from their guys in the gym or from the performance crowd, and they want to skip the optimization. Is that just my clinic, or is that a pattern that sometimes happens because it's bright and shiny out here?
Yeah. All of us want to do it the easiest way possible. Like we
Yeah.
all want like the hack. Like the whole reason that like biohacking became a thing is because people are looking for shortcuts. And I totally get that. Like I'm not judging.
Yeah,
But
max in, get the max out of the minimum.
yeah, we want to
Yeah.
put the minimal amount of work in and get the maximum. And we also are like we all also want to like find the thing that nobody else knows about that's gonna like change everything.
Explode everything.
Like we want to be the ones who can go out and tell our friends about this thing that we did that has made all the difference and like we're the hero. And I think doctors, and I can speak for myself, like I feel the same way. Like I want to be the person who discovers like this very secret, molecule that was hidden in the desert that no one knows about. And now I can bring it to you and it's going to change everything. And then, like I think that we get caught up in that sometimes because it's exciting. But I do think we have to be a little careful in making sure that the things that we recommend are, and if they're not evidence-based, which a lot of things I talk about are not firmly evidence-based, but I tell you, this is not necessarily evidence-based, but here's my experience, or here's what we do know, and here's what we don't know. So I think we have to be honest about what we do and don't know.
Well, and that's what I really appreciate that. And that's what I wanted to get into, because within the longevity world, it's often called evidence influenced, meaning there are studies. Sometimes they're only in murine models, which that's a fancy science word for rats and mice. Or maybe we've done them in rabbits. In orthopedics, we tend to do a lot of things in mice and rabbits. So it doesn't mean there's nothing. It's not like we've plucked it out of the air, but it has not yet been done in humans. And so evidence influenced, often as we're thinking about longevity, the studies just haven't been done. In 1993 were the first time that women were actually included in any scientific studies, let alone let's try new idea studies, right?
Yeah.
So how do you just said you explain the risks, you explain where the data comes from. Do you wait until someone's optimized? in their general health, you've fixed their cholesterol, or you're working on their cholesterol, you're working on blood sugar, to then move into the evidence influenced, or do you mix the two worlds? How do you handle that?
I kind of tend to mix the two worlds. I mean, for instance, like a good example is the sort of the use of like microdosed GLP-1s, which is people have a lot of opinions about this,
They
right?
do.
Like
Yes.
there's people are like, you should not do this. It's not evidence-based. And then some people are like, we should do it all the time. So, I think that there is enough evidence to suggest to me that it's safe to use these medications in low doses. Okay.
Mhm.
And then whether or not it's going to help everyone, I'm not going to give it out like candy, but I do think that there are a number of use cases that we keep learning about more. Like every single day, I learn about new things that these medications can do potentially. So like I will use these medications at micro doses that are lower than the doses that they are approved for
Mhm.
in patients if I'm trying to reduce inflammation, or maybe I'm trying to work on their mast cell dysfunction. There are all these things that we know that they can do. And so, I just tell them like, we don't know if it's going to work, but I don't think it's going to hurt. We're going to watch you and we're going to see what happens. So I will mix and match a little bit, just knowing, always telling patients we're using this off label, or this is not yet FDA approved because it hasn't gone through any process yet. Like, kind of making sure we're very honest about that.
Well, and I think that's a critical conversation. So if people are listening and they're going to longevity doctor, any kind of doctor, and the doctor or the clinician, whatever they call themselves, says that I guarantee,
Oh, yeah.
or I know that's a red flag.
No,
I
that's bad.
guarantee, doesn't matter that there's no human studies, we know, or I think the transparency of the way you explained it is the buyer beware that I tell my patients. For instance, here's an example from my clinic. I have a lot of performance type people who know people who know people. So when their kids come to me, they're like, okay, this is a meniscus tear. And I'm saying this needs to be fixed because it will heal because it's in the blood zone. And somebody says, I don't want a needle scope. I want you to give them BPC 157, because I hear it heals things well. To which I respond, well, number one, if you were an adult, I would have much less to say than your 13-year-old, number one. Number
Yeah.
two, right? Number two, I'll have this discussion with you citing literature that's been done in the murine models. And I'll tell you how it works in murine models, blah, blah, blah. And but that's not my first line of treatment for something that I can heal with a known thing, right? So that's the kind of conversation I have. Like, this is a child, not a sentient adult. But the true transparency. I mean, people ask me, and maybe we'll talk about some of your favorite peptides or new things. The same thing about, we're learning so much about methylene blue. It's the blue tongue phenomenon, or some of the other things that are out there. I don't know that we know that there's sure bets in anything. Is that true?
Yeah, I think your BPC is a great example, because BPC 157, it is the most well-known peptide. If anyone knows peptides, that's the one that they know. By the way, I have a company that makes oral BPC 157 with a couple of other peptides combined. It has palmitil ethanolamide, which is an anti-inflammatory. And so like I've had this for a long time. It's oral, so it works differently. But if you go back and actually look at the literature, you're right. It is in animals or like petri dishes. Like we don't have, forget large studies. We don't really have like human studies. Most of it is kind of anecdotal. Like my cousin took this and it helped his knee.
That's what happens.
And I will say, like I've heard a ton of amazing stories. I have like all of these athletes. I have a whole slew of strongman athletes. I don't even know this. They apparently take it's called Rapid Rebound, the product that I make, and they're like, it's really helpful for recovery, and we love it. But it is still considered very experimental. What I think is interesting about this, where we are in the world right now, is we can actually start to capture this real world data. Like we don't necessarily, yes, we should do clinical studies. Yes, we should do trials. And we can also capture real world data. Like what are people doing? How is it affecting them? We can use wearables. We can use, labs, various things. And we have the technologies now to pull it all together to actually see what seems to be helping or not in the real world. So I think we need to do a better job at that.
Well, and you know what you're talking about, millions and millions of data points so that we very quickly, if people will actually chart or record what they're taking, in addition to the data we're recording, how did you sleep, what's your heart rate recovery, blah, blah, blah. You can really instantly find out great things from that.
Yeah, absolutely. And one of my other companies is I'm not trying to plug all these companies,
Oh my
but
gosh, Amy,
I
you have
know. Well,
some company.
I don't
Yeah,
run the company. I was one of the
part
founders
of
and then
it.
I
Yeah.
away. But it's called Reputable. And they essentially the whole point is taking real world data, wearables, labs, and running clinical studies on
Mhm.
like wellness products, supplements, devices, protocols, whatever, that are using all of this data in the real world, aggregating it, and then using AI to essentially create the insights from that data set. And it's amazing. Like we have so much data, and now we can actually say, it could take all these things and say, you know what, it seems like when you take these in the morning, that your pill in the morning at this time, you're getting these benefits, but if you take it at lunchtime, you're not getting the benefits. Circadian rhythms are playing in. Like there's so many variables that we never even realized were part of whether a medication or a supplement or a technology helps us.
And do you are is Reputable then able to give precision individualized data? Like Vonda, you take this in the morning and this is how it affects you all day versus my husband has to take it at night. Is that the
Yeah, I
granular?
mean that is part of it can to some degree, and that's certainly also on the roadmap is being able not just to take your own, your data and give you insights, but then also eventually to be able for you to say, you know what, I'm a 45-year-old woman who exercises 3 times a week. Like, what are other women who are the same age as me that are also, similar ethnicities or similar whatever, like what is their experience with this tool? And so to be able to kind of to look in the query the data for other people that are like you is something else that we're working on.
So if you're one of my listeners and you're wondering, that is so fascinating, how do I plug in, where do I start, where does your average mere mortal woman person like me start? What are the steps to filling the gaps, discovering, harnessing these kind of data? Lay out a blueprint for people, so because they're like, this
Yeah.
is so cool, but I don't know how to do
I
it.
know it's a lot. Well, I think the first is to figure out like how much do you actually want to know? Like some people want all the data and they want to like become obsessed with it. But then some people it stresses them out. It makes them anxious. Like they don't want it all. So just kind of understand who you are. But you could start with a simple wearable, whether it's a ring or a watch or a, whatever kind of wearable device and just start seeing what's happening, how things you're doing in your life are affecting your sleep and your steps and your stress and all of those, your heart rate variability. Certainly you can keep it at Excel sheet or something if you want to. But then there are also consumer facing apps like Heads Up Health is one that's a consumer facing app. You can get it for a couple of dollars a month that will take all of your wearable data. You can also dump in your lab data. You can dump in various things. It'll make you like pretty charts and
Wow.
you can shoot. I'm not associated with them, but they make pretty, like some really interesting information that you can get just from the things you're already doing, but it puts
Yeah.
it in a way that you can look at it and be like, you know what? It's weird. Whenever I eat cookies, my blood sugar goes up. So I should probably not do that.
Exactly. Well, I love that simple way to start. I mean, that's exactly how I started. I'm wearing it now, but almost 2 years ago, I started as an experiment to observe how my body responds to life, stress, sugar. This is a CGM for those of you, a continuous glucose monitor. And you know what? You're right. You can start very basically. I know exactly how my sugar is going to go up when I do surgery. I know exactly what it's going to do if I do the whole vinegar, not the apple cider vinegar thing in the morning. Or I know based on these little data how extremely sensitive to carbs I am.
Mm.
But it informs a lot of behaviors,
Yeah.
right? So that's a really good place to start.
Yeah, it's super simple. I think CGMs can be really powerful, and I think also the idea that, it's not necessarily a bad thing that your blood sugar goes up. Like it's supposed to go up when you exercise or when
Mhm.
you're,
You're
when you're
stressed.
stressed
Yeah.
out. Like these are all normal things, but it's also about like, it's more about kind of what are the trends and what are the overall levels and things like that. But, to me, more data is better as long as it doesn't make you anxious.
And it certainly can. So, another thing, we're going to pivot and go to another area that I've never heard you speak about, but I've seen online that you speak about with some frequency, which is human sexuality.
Hmm. Yeah.
If we've been talking about midlife and the critical decade and midlife and all the changes and the untapped biohack of estrogen. How does midlife human sexuality fit into this picture, and how do you tie it together?
So I've actually spoken a lot at events. When I first started speaking on platforms, like events, it was actually about sexual health. It was about sexual optimization, and I love the subject. I talk a lot about the relationship between sexual health and longevity, and this is something else like people don't really think about that relationship.
Let's
But there
talk.
have been. It's interesting. There's a couple of studies. There was a big study in 2020 in the Journal of Sexual Medicine, and they looked at like 15,000 adults in the US, and they followed them for like 7 years or so. And they found that people, women, men and women, who had sex at least once a week had a 50% lower all-cause mortality rate compared to people
50%?
50 compared to people who, and it wasn't, that the conclusion wasn't that sex keeps you healthy. The conclusion was that there is a very strong association between being sexually active and having sex and health and reduction of diseases, especially cancer and heart disease. And so I think about sexual health as kind of being this great portal into your rest of your health.
Right.
It's
if
like
you're
a little,
healthy,
yeah, it's like a portal. Like if you're having a sexual problem, male or female, and whether it's low libido or lack of desire or arousal or orgasmic problems, oftentimes something else is going on. It may be a social issue with your partner. It may be a mental or emotional issue, depression, anxiety. It may be physical, obviously blood flow issues, hormonal issues, etc. It may be spiritual, like you may have some kind of, like you taught that sex was bad and you still believe that. Like, so all different types of health play into your sexual health. And then on the flip side, people who are sexually healthy and are happy in their relationships and such, that also tends to radiate out. We see improvements in blood pressure, less pain, less anxiety, less depression in people who are in healthy relationships with, sexual relationships with their partner.
I love that you have tied this to so many physical health benefits, because sometimes we think of it, some experts that I love dearly, it's all in the brain, right? And it's just and
Right.
so, or it's all in the woo-woo emotional relationship. But to physically tie, if you're healthy enough to have sex, you're healthy. And
Yeah.
what were people shocked the first time you presented it or pitched the idea at these conferences? What were their responses?
Yeah, I mean, sometimes it's funny. You'll see my name on that, like Amy, sexual optimization. I now call it a sexponential medicine. I talk about exponential exponential, but it's sex. So I talk about sexponential medicine.
That's great.
And sometimes people like a little scared and they'll like kind of start to walk towards the door like they're ready to leave. But the point is to try to make this approachable and make it something that all of us, like, we can talk about it. My kids can be in the audience and I can still talk about it. Because I do think it's important to understand, what's interesting in one of the studies that I read that I think is so fascinating. This is from the 80s and it's hard to find, but it was in the gerontologist, and they found that in men, the quantity of sex that they were having, so the amount of sex, was directly proportional to their health. So guys who were having more sex were healthier. In women, it was the quality of their sex. The quality, it was whether they enjoyed it, whether it was pleasurable. That was what was associated with health in women. So like in men, it's like they got to show up, run on the treadmill, and they're healthy. In women, you got to show up, run on the treadmill, and
I love it.
Yourself.
Oh my gosh. So it really is part of a woman's psyche in addition.
It's a higher bar. And obviously we know that women already have a harder time, enjoying sex and reaching climax anyway. And so now we've got this like higher bar of like, you got to do it and enjoy it.
Seems almost unfair.
It's unfair.
It's unfair. Well, that's fascinating. And through this, because some, people are highly motivated by sex, can this be a motivator for better overall health?
Yeah, 100%. I think it's fascinating. In men, this is one of these research gaps, right? In men, we know that the number one cause of sexual dysfunction, of erectile dysfunction, is vascular disease. So it's a blood flow problem, right? It's either the blood flow is not getting to the penis or it's not staying in the penis. So it's blood flow. And we have essentially the same setup that men have, right? And yet with women, when we talk about sexual dysfunction, it's always about like, oh, she's, her mind isn't in it, or we talk about these other, like you mentioned, that we don't talk about blood flow. And
Mhm.
yet 100% that blood flow is absolutely one of the main causes of sexual dysfunction in women. It's just
Right.
not talked about or studied that much.
I think women are always surprised because I hang out with a lot of urologists these days that we have engorging erectile tissue just like men do. You just don't happen to see it, a lot of
Yeah.
it. You see the
Yeah.
guy, it's all out there. But I think women are already always really surprised by that because it's just
Yeah.
not out there. You can't see it. You can feel it, but
And it's harder to measure too. Like it's easy to measure, to do a study on a man, and you can actually measure erectile firmness. There are devices for it. You can look at it at home and see if it's happening or not. But for women, it's a lot more difficult to measure, even like in a clinical setting, and certainly even at home, because it's harder to see. And so because of that, we just kind of don't talk about it. But blood flow is it's a big reason, like it's a big issue. And lack of estrogen at menopause reduces blood flow to the area. And then you also have all the structural changes that happen, in the vulva and the vagina because of loss of estrogen. So you have all these things coming together in midlife that leads to a lot of sexual problems.
so we had earlier talked about uh, hormone optimization, and I prescribe 4 or 5 things for people, and I'm wondering if for this exact blood flow issue, is vaginal estrogen part of your prescription pad?
Oh, 100%. Yeah. I think that vaginal estrogen is the female Viagra. It is it doesn't work the exact same way, but like Viagra, it increases nitric oxide. And so you have increased blood flow going in. Like Viagra, if you take it systemically, at least, it improves cardiovascular health. So the blood vessel health itself. And
Mhm.
like Viagra, it helps to maintain the structural integrity of the sexual organs. People don't know that Viagra does that, but Viagra is actually helpful for keeping the cells in the penis healthy. But estrogen does the same thing in women. So I think that all women over the age of 50 or so, maybe even younger, should have access to vaginal estrogen.
Absolutely. And age is no barrier. I mean, there have been 80-year-old women who have
Yeah,
had skin issues or dryness or a variety of things that I have given vaginal estrogen because it is safe for everybody, even
everybody.
women with breast cancer.
100%. I wish I could go back to my ER days and for all the little women who came in with their urosepsis, their, infections that led to them being in or all all the UTIs, I wish I could just start handing out vaginal estrogen to all those little women and tell them, stay on it for 3 months and tell me if it doesn't change your life.
Amy, I was thinking the other day, I wish it weren't prescription. I wish this was Mexico, because when you get off a cruise ship in Mexico, you can go to the corner drugstore and just because I would literally hand out little packets like,
Yes.
here's yours, and here's,
Yeah.
oh, it's prescription here. So it's a little more
It's
regular.
prescription, but it is very inexpensive. Like I just looked yesterday and you can get it for $13.21 from the cost plus drugs.
Mhm.
That's that's a month or two supply. Like
Yeah.
$13. That's without insurance. So it is, if you can get your doctor to write it, it is affordable, which is great.
As we're winding up, I want you to future cast. I want to hear what you were really excited because we've covered the evidence based, we've covered evidence influence. What are you excited as you're in the heart and soul of the longevity community and thinking big thoughts? What are you excited about in the next 5 or 10 years for people
I'm
living?
excited about this kind of tech-enabled longevity, experience at Humanaut, which is where I'm the co-founder and chief medical officer. We're working to build the tools to bring together, like essentially to do rapid learning. So yes, we can use peptides. Yes, we can use stem cells and regenerative medicine and PRP and hormones, and we can do certain types of training programs. But then being able to take all that data and start really making sense out of it and creating these personalized, kind of health blueprints for people. And it's a lot of medicine is complicated, and like our the way our technology, none of our technologies work together. Like it's difficult, but I think that is like if we can master that, like bringing together all these different things together and using AI to help us, that we're going to make massive strides in the longevity field and just in medicine in general.
And so after you have enough data aggregated and enough observation, I think we'll find out these are the key, I'm making this up. These are the key 10 things that we have to get right. And then
Yeah.
here are nuanced things that are personal to me, right?
Yes.
These are the weighted data, right?
Yeah.
Yeah. How
Yeah, and we'll also
carefully.
figure out like the very specific things like we talked about before. Like for instance, we know now that if you eat a bagel in the morning, your blood sugar is going to react differently than if you eat that bagel at 10 o'clock at night. Like
Mhm.
just the circadian rhythm differences, the way that your body sees food changes throughout the day. And then of course, if you add a workout in, how does that change how your body sees that bagel? So there's so many very different specific things that we can learn once we're able to do this on a really high level.
In real time is what you're
In real
saying.
time. Yeah, in real time, and then give you insights really quickly.
I can't wait. It's fascinating. And I don't actually think it's going to be 5 years because
Yeah.
technology doubles every 2 years. So it might be in 2 years that all the ideas that you're laying into the algorithms of Humanaut come easily
Yeah.
accessible, right?
Yeah, we're hoping for faster than that, but for sure, like I think within a few years we're on that exponential growth curve, as they say. That's sexponential and exponential.
Oh,
And
so
so
good.
we really are developing. Everything is coming together so fast for all of us in medicine and science.
It's exciting. Well, I really appreciate another hour with you. Thank you. And I look forward to seeing you in all of our upcoming events together.
We're gonna have so much fun. I can't wait. We'll do all kinds of social media. We'll do
Oh,
stories, videos.
together. Yes.
Yes, together.
Everybody watch for it. Okay. Well, thank you again today. I'll talk to you soon.
Thank you. Bye-bye.
Bye.
Thanks for joining us on Hot for Your Health, where we bring you conversations from the bleeding edge of science, health, and culture. You can find links from today's show and connect with me at drvondawright.com. Don't forget to subscribe and leave a review wherever you listen to podcasts. I'm Dr. Vonda Wright. See you next week.